Hello and welcome to Pregnancy Info. Today we are discussing the 14 myths about breastfeeding. Breastfeeding is very important for your newborn, but there are certain myths that are related to the process of breastfeeding and many more. So in this video you will see the 14 myths. Myth number 1. Breastfeeding is easy. Babies are born with the reflex to look for their mother's breast. However, many mothers need practical support with positioning their baby for breastfeeding and making sure their baby is correctly attached to the breast. Breastfeeding takes time and practice for both mothers and babies. Breastfeeding is also time intensive, so mothers need space and support at home and work. Number 2. It's usual for breastfeeding to hurt. Sore nipples are inevitable. Many mothers experience discomfort in the first few days after birth when they are learning to breastfeed. But with the right support with positioning their baby for breastfeeding and making sure their baby is correctly attached with the breast, sore nipples can be avoided. If a mother faces breastfeeding challenges like sore nipples, support for a lactation consultant or other skilled professionals can help them overcome the issue. Number 3. You should wash your nipples before breastfeeding. Washing your nipples before breastfeeding isn't necessary. When babies are born, they are already very familiar with their mom's smell and sounds. The nipples produce a substance that the baby smells and has good bacteria that helps to build baby's own healthy immune system for life. Number 4. You should separate a newborn and mother to let the mothers rest. Doctors, nurses, and midwives often encourage the practice of skin-to-skin, also known as kangaroo mother care, immediately after birth, bringing your baby in direct contact so their skin is against yours is a very important practice that helps them to find and attach to the breast. If you can practice this within 1 hour after birth and then frequently after, it helps to establish breastfeeding. If the mother cannot do this, then the partner or another family member can step in. Number 5. You should only eat plain food while breastfeeding. Like other people, breastfeeding mothers needs to eat a balanced diet. In general, there is no need to change food habits. Babies are exposed to their mother's food preferences from the time they are in the womb. If a mother practices that her baby reacts to a specific food she eats, it is best to consult a specialist. Number 6. Exercise will affect the taste of your milk. Exercise is healthy also for breastfeeding mothers. There is no evidence that it affects the taste of your milk. Number 7. You won't be able to breastfeed unless you do it straight away. It is easier to get breastfeeding started if you begin in the first hour after birth because a baby reflexes are very strong at that time. They are ready to learn to feed at the breast. If you don't latch your baby on right after birth, do it as soon as possible in your situation. Next, you can never use formula if you want to breastfeed. Mothers can decide they need to use formula on some occasions. While continuing to breastfeed, it is important to seek unbiased information on formula and other products that replace breast milk. To keep breast milk production going, continue offering the breast to your baby as soon as possible. It can be useful for mother to consult lactational specialist or skilled professional to help with the plan. Many mothers cannot produce enough milk. Almost all mothers produce the right amount of milk for their babies. Breast milk production is determined by how well the baby is latched on the breast, the frequency of breastfeeding, and how well the baby is removing milk with each feeding. Breastfeeding isn't a one-woman job and mothers need support. Support like ongoing breastfeeding guidance from healthcare providers, help at home, and staying healthy by eating and drinking well. You shouldn't breastfeed if you are sick. Depending on the kind of illness, mothers can usually continue breastfeeding. When they are sick, you need to make sure you get the right treatment and to rest, eat, and drink well. In many cases, the antibodies your body makes to treat your disease or illness will pass on to your baby, building his or her own defenses. Another myth: you can't take any medications if you are breastfeeding. It is important to inform your doctor that you are breastfeeding and to read the instructions with any medications you buy over the counter. It might be necessary to take medications at a specific time or in a specific dosage, or to take an alternative formulation. Another myth: babies have been breastfed are clingy. All babies are different. Some are clinging and some are not. No matter how they are fed, breastfeeding provides not only the the best nutrition for infants, but it is important for their developing brain. Breastfeeding babies are held a lot because of this. Breastfeeding has been shown to enhance holding with their mother. Myth is that it is hard to wean a baby if you breastfeed for more than a year. There is no evidence that there is more difficult to stop breastfeeding after 1 year, but there is evidence that breastfeeding up to 2 years is beneficial for both mothers and children. All mothers and babies are different and need to determine together how long they want to breastfeed. Another myth: if you go back to work, you will have to wean your baby. Many mothers continue breastfeeding after going back to work. First, check the policies in your country and your own workplace. If you have the right to time and a place to breastfeed during working hours, you may be able to go home and breastfeed. Ask a family member or friend to bring your baby to you or to express your milk and take it home. If you don't have the option to breastfeed during working hours, look for a moment during the day of express your milk and then feed your baby directly when you are at home. If you decide to give your baby a breast milk substitute for some feeds, it's still very good to continue breastfeeding whenever you are with your baby. So these are the 14 myths that women can face in her breastfeeding session. So share this video with the women who are breastfeeding, and I hope this will help her a lot in this situation. And how do you find this video? Must do a comment in the comment section. Thank you.